All right. So we know that what we're getting into today is wonderful and traumatic at the same time, whether it is traumatic for the patient, the mother, or the EMT or paramedic that is having to deal with birthing a baby, because it's not something we do on a regular and consistent basis unless you have that level of attraction where you attract all the pregnant people, so you birth all the babies. All right. So we're going to look at some of the growth and development and aging and assessments to know how we need to manage these patients. So today we're going to end up having a blended class with EMT students and the advanced EMT students. So basically what we can and cannot do does not change. Okay. 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 All right. One of y'all catch the door for Asia.
Asia?
Yeah, one of y'all catch it.
Outside?
Yeah. All right, so we are, pick a spot. So we're going to be looking at the fact that we have a blended classroom. For the most part, the management of the patients, because there are two patients in this situation when you have a pregnant female that is giving birth. So understand that you have two patients. In one unit, you have already exhausted your resources as to what you can and cannot do. Kelly, I already sent the email for the, yeah, I already sent the email for the link. All y'all gotta do is get it and log on. Okay. So when we're looking at obstetrics, we are looking at recognition and management of normal deliveries. We're going to be looking at a pregnant women when they have vaginal bleeding and the anatomy and physiology of normal pregnancy. And when we say normal, we're talking textbook normal because each patient's normal may be different. So we're going to be looking at recognition and management of complications of pregnancy and how we need to assess these patients. Now, in the advanced EMT book, it's chapter 35. In the EMT book, I am not sure what chapter it is, so do not make me lie.
34.
Okay, so.
That's what he had me put in as the code.
Okay. Yes. OB. Now, as far as management, we're going to look at both normal and abnormal deliveries. Okay. And when we look at abnormal deliveries, we're going to be looking at nuchal cords, prolapse cords, and breech deliveries. If they are not managed properly, it can be bad for the baby. Now, we're also going to be looking at management of third trimester bleeding. So we're going to be looking at partial previa, placenta previa, and abruptions of the placenta. Spontaneous abortions or miscarriage, ectopic pregnancies, eclampsia and / pre-eclampsia. Okay. So when we start looking at pregnant people, it's a lot of stuff that could go left, and we need to know how to handle that. Now we look at trauma. Now our slides on the AEMT side are not going to match up absolutely with what y'all have on the EMT side. But this lecture is still, the information basically is still the same. So for detailed information, you have to look at your slides when you have time. But the ones that we have for this YouTube video is going to be for the ones for the AEMT class, okay? So just know that there is a difference.
You sent the link to the.
Yes, it's to your email. All right. Now, when we look at our national competencies, we're going to look at how we will look at the difference of trauma in the pregnant patient, a ped versus old people. They have to be managed differently because they are different age groups. And so when we look at this, we're going to also look at how we have to deal with people that are cognitively different. So this may be differently abled people. This could be people with autism, Down syndrome, other intellectual disabilities or physical disabilities. So, standard. In a perfect world, most births are uneventful. They don't need anybody to be there except the mama. Standard. That's why you see most of these people that are delivering their babies in their car on the way to the hospital or in cabs or Ubers or at the house or whatever the case may be. Standard if there's nothing wrong, nothing going on that we need to be worried about. Biggest thing they have to look at is suctioning the mucus out of the mouth and nose, getting them dry, well, cleaning them up and keeping them warm. That's the extent of it. Now, would they need to go to the hospital to get evaluated afterwards? Yeah, because there are whatever special drops they give to babies when they're first born and whatever evaluations they do to make sure everything is good to go. Yes, they will still need to be transported. Okay. Now, if you arrive to a scene and the woman is in labor, everybody will be scared because if it's her first child, she don't know what's going on. You ain't birthing no baby unless you've done had kids before. So you may not necessarily know what's going on if you've never had to birth one before. It's exciting and traumatic at the same time. It's not something I look forward to, especially in the back of an ambulance because it turns into a slip and slide. Okay. So you have to look at that. If they are imminently delivering, we're not going anywhere. We're gonna stay right where we at and birth this baby. Okay. But at that point, you may need to another ambulance because you have two patients, depending on what's going on. Okay. Now, like I just said, if it progresses fast, you got to catch. Okay. Usually, the only thing you have to do is support the baby, and that's it. In a normal world, in a perfect world, we don't have to do anything but be there to catch. Keep the baby out the dirt.
Right.
Okay.
That's like the chicken.
Now, if this is baby number 8, you may not make it. Okay.
You may not even be able to catch that thing.
Yeah, it might fly across the room, and like they do in the movies, it just depends on, how much pressure is back there. What we are trying to help them prevent is, I forget the word because my brain just went blank, but a fast birth, because that's not good for the mother or the baby. Okay. So we just have to slow things down a little bit to make it less traumatic physically on either one. Now, when we look at everything, this is a cross section of the body with the alien in there. So when we're looking at the reproductive system, we have ovaries, fallopian tubes, uterus, cervix, vagina, and breast. This is our reproductive system. Well, the breasts aren't part of the reproductive system, but it's part of the feeding system for the midget. Okay. So usually, pregnancy most frequently occurs during a certain time of the menstrual cycle after the ovum is mature. That is when you are the most fertile. Okay. Some women know exactly when that time hits. Um, and this is usually about a week after the period is over is usually that window for fertilization to occur. That's when they say it's more optimal, when the body's basal temperature is warmest and everything is perfect. To me, that is a time to avoid.
Yeah.
Okay, for for us and
Go
them.
into a rock. Hide
Okay.
underneath the rock.
Some people, that's when they notice their libido may increase. So that may be a little bit of a sign for some people. Some people that's a tell. Some people may not notice when they feel the warmest. Usually your body temperature go up a little higher than it is when you have your period. And if you pay attention, that's usually the time when you're the most fertile. Now, the process of fetal development starts after fertilization. So the sperm hits the egg, it eats through the shell, it gets in there, and they form Voltron and become one. So half of the genetic makeup from the daddy and the mama get together and create us. Okay. Now, that's usually in the distal third of the fallopian tube. So that's usually when it's on its way to the uterus, usually when it gets fertilized. Okay. What's up?
Yesterday, I was asking them about I told the lady that was doing the autopsy on the female that I wanted to see like the ovary and the uterus and stuff. And the whole thing is literally only like this big.
Yeah.
It's like an ovary and tubes, and then, no, it's like the uterus, like yay, and the little tubes, and the little.
Yeah.
Wow.
Your uterus is usually not much bigger than like a extra large chicken egg on a regular basis.
Yeah, that's about what the size is, like an egg.
Yeah, they look like little shoestring French fries. And then you have your ovaries that look almost like uh, jawbreakers.
Yeah, hers were almost a little bit elongated, and they looked like
Yeah.
they weren't as rounded and smooth looking as the actual uterus was. And they were just like little.
Yeah. I mean, when I say jawbreaker size, it's about the size, not the shape. Now the amazing thing is, and we're going to get into this part in a little bit, is that when you look at the anatomy, how it stretches once the alien implants and grows. Yeah, because it goes from the size of about an extra large chicken egg to the size of a watermelon. And then then it shrinks back down to about the size of extra large chicken egg. Mhm. Yeah. And it says from the time of fertilization to the end of the 9th week, everything goes from an embryoblast to a blastocyst, and then it becomes an actual embryo. That's when it becomes the alien. It's just not implanted to have a blood supply. Okay. So here is kind of what Kelly was talking about. So you have your different stages of your ovarian development before it's released out into your fallopian tubes. Okay. So usually once it gets about midway, once it hits that bend and fertilization occurs, it just keeps the cell itself starts splitting until it gets down to the uterus. It finds a place that it likes and stays there. And it digs in like a tick. Well, it depends. Okay. So it digs in and it latches on like a tick. That's the best way I know. I can't, I've never really seen scabies actively get in where it burrows under the skin. Um, but that's the process. It burrows into the uterus and then it stays there and develops from that point. Okay.
I always wondered how the placenta began. I kind of felt like after it does its burrow thing, the placenta starts growing from there. Because the placenta is what's attached to the inside of the wall, the wall.
Yes. Now, when we start looking at gestation, that is dealing with being pregnant. The umbilical cord connects the placenta to the fetus. That's the lifeline. That's where it gets all its food, oxygen, exchanges carbon dioxide. All the life processes occur through the umbilical cord, which is attached to the fetus. Okay. That's why we have a belly button. Okay. Now during labor, everything it descends through the birth canal, amniotic sac ruptures sometimes, and then the child is born. Gestation is the time it takes for it to go from an embryo to a full-fledged, as we recognize it, as a baby, physiologically. Okay. Now, as we get into this, we will find some videos that may get extremely graphic, but we're gonna watch them anyway. Hey, we birthing babies today. All right, I sent you the link. All right, now a standard pregnancy is 40 weeks. I know we think it's 36, but it's not. Some people will have go through birth at 36 weeks, some at 32, some at 20. It depends on what's going on with them. But it's actually 10. It's actually 10 months from start to finish in a perfect world. Okay. And it's divided into 3 trimesters. Usually you hear fetal tones at about 17 to 20 weeks. You may actually hear them before that, depending on, hey, the strength of your ultrasound that you use to also take the fetal tones. The better ones, you may be able to hear it sooner. If you're doing an ultrasound that's transvaginal, you may be able to see everything sooner too. To catch you, Maples, to catch you and Kataria, since we birthing babies, this is a kind of a long and involved chapter. It is exciting and traumatic simultaneously. So we're gonna get a little graphic. So just be expecting of that. I didn't have your email to send you the link, so Kelly, if you or Patricia have it, send it to Maples. Now the slides that we're going through are for the advanced EMT, but the information is pretty much the same. Okay. Now, it says about ultrasound by 18 weeks. Usually they won't do it till 20. Go ahead, that's fine. You will be able to tell gender. Hello, my cheerings, my little cheerings. I did not have, I have Jaden's email. Send the link to the slides to Kyle. Okay. Now, during the first 28 days of life, they are considered a neonate. You need to know this. This is a national registry question that you will see henceforth and forevermore. Anything over 28 days is an infant. Okay. We went through this on lifespan and development. I know y'all just did this not too long ago with Davis. So remember that. Anything between 1 month and a year is an infant. Know these numbers. You will see this henceforth and forevermore. Now, during pregnancy, they go through, your body goes through, well, I'm not going to say your body. The female body goes through a lot of changes. Blood volume increases by 50%. This is why you end up feeling hot. Yes, it doubles. This is why you end up feeling hot, because you have more circulating volume because of the alien. Okay. So when you hit about 40 weeks, your blood cells increase about 30%. So just know when you're pregnant, your blood volume is going to double, basically. All right. Your cardiac output increases from 30% to half. Okay. So if your heart rate was about, let's say normal, about 60, you're looking at your heart rate jumping up to about 90 to 100 on a regular and consistent basis, because you have more volume of blood to push around your body, and you have to share it with an alien, parasite, however you want to put it. They leach off your system. Okay. Now, once you hit the second trimester, that's when you hit about 4 months on forward. The fetus has developed, mute that, to the point that it can compress the inferior vena cava if she lays on her back, and it's probably sitting on top of the bladder, which is another reason why women end up going to the bathroom a lot. Okay, so you have an alien that's sitting on top of your bladder, probably tap dancing, ain't no telling. And if you look at where you're, and I don't have them in here because they took them, your inferior vena cava, the ones, Kelly, you went to the ME's office yesterday. Poole said, he confirmed, your inferior vena cava is huge. So when you have something laying on that, it's going to drop your blood pressure. So if they're laying on their back, it tends to maybe cause them to have an altered mental status because they're not getting the blood and oxygen to the brain.
I thought she said that was the
It's still part of your inferior vena cava.
large.
It is. It's a huge vessel. Now, because you have more blood cells, you need more iron. Iron is what makes your blood cells red. So when you're looking at this, you need more iron for the more blood that you have. You're going to need more oxygen for the more volume of blood that you have. So when you start looking at this, pregnant women breathe faster, their heart beats faster, and we're not even getting into the psychological aspect with the hormonal ups and downs. Okay? You have something sitting on your intestines, so you don't digest as well as you used to while you're running to the bathroom more often to urinate. So if you start looking at where all your organs are situated in your abdomen, you have something that is pushing everything back and up to make room for itself. Now, when we start looking at the Wonder Twins that are in here, how big of a baby were you, Kyle?
13 pounds.
Jen? So this is at birth, okay? So they were some thick, chunky babies. If you start thinking about where they were situated in the pelvis, their mama's intestines were pretty much almost flattened out and pushed to the lateral walls and up towards the diaphragm. Okay? So think about how when they were eating, you're going to have slower digestion. They may have had issues, and y'all can confirm this, I don't know, have issues with having bowel movements because they can cause constipation. They could have fits and starts and having gas. The stomach is pushed out of its normal position. Yeah, I didn't think about all this, huh? And then the bladder is pushed further down into the pelvis, making it smaller. Is that making sense? And that's with them. This also happens with what could be considered normal sized babies that are between 6 to 9 pounds. Okay. Now, because of all this stuff being pushed around, they can also have fluid retention in the extremities because higher blood circulation volume and slower digestion, which is helping move everything around. Now, one of the complications that they can have early is bleeding. This can threaten the fetus itself because you don't know if it is the placenta separating from the walls of the abdomen, if it is occurring because of breakthrough bleeding, if there was trauma to the vaginal area or the abdominal cavity. So anytime you see bleeding during a pregnancy, it could be threatening miscarriage. Okay.
What's breakthrough bleeding?
Well, sometimes that happens when implantation occurs. It can cause some bleeding. Some people, it may be a little bit. Some people, it could be a lot. It could look like a regular period, which is what happened to me. I thought I was having a regular period. That was not the case. All right. Now, this is an aborted fetus, and the picture is compliments of one of my old instructors. She does a lot of the pictures for the AAOS textbooks. She's down at Albany State. Rhonda Hunt.
Can't get yours.
Okay. Well, you may, okay, Katari just turn his around so you can see. Now, this happened during the first trimester. Now, it depends if it was spontaneous because there were situations going on in the mother's body where she could not support the fetus. First thing your body is going to do is protect itself. That's why I refer to it as an alien, a parasite. Your body is going to get rid of it to protect you because that is your body's function. Now, this is not to say that it does not happen electively because somebody decided, look, I can't handle this and I don't want to be anybody's mama. Okay. Um, let's say that they did decide to have an abortion or if they're having a miscarriage. Either way, our job is not to judge. If it was spontaneous, their body did it of its own volition. Now, if it was a decision they made, it may have been the best decision for them and that child. Our job is not to judge. Our job is to keep them alive in the event that they may have excessive bleeding or pain or incomplete abortion or miscarriage, same thing, and they need medical attention. I see some questions in some heads, some hamsters wheel spinning. What's the question?
So say like they're bleeding. Yes. Well, how do we stop it?
We would not put anything in the vagina.
Yeah.
There are, and I wish I had the bag in here. We have what is called like an abdominal binder. It looks like a big maxi pad that you can use. You can slide it up under the butt and just cover the vaginal area. That's it. Even as a paramedic, advanced EMT, we do not put anything in the vagina. We just cover it and ride out. We get them to a hospital that has a OB, has a labor and delivery, and has surgical capabilities because they may need surgery. But they absolutely need somewhere where they specialize in birthing babies. Now, if they are bleeding a lot, you may need to stop at the closest hospital to try to get them stabilized. But like up here, it's a hospital damn near on every block. You get them to the one that's appropriate. Okay, if it's close to you. What, Jetty? I see the question. What is it? Oh, okay. Now, we just saying some people could be threatening abortion. They may not even know they're pregnant. Most of the time, most women do not know. When I found out, I was 2 months. I did not have a clue. I had a suspicion, but I thought I was tripping. Um,
Your grandfather went with a friend if she was going to take a test, and that was the only reason why I tested it. She was going, I just heard that she was not.
Hey,
Hi, I got caught in the rain.
it's fine. We birthing babies today.
He
All right.
knows about that. How many have you got again? 15?
Not that I know of.
5 and no.
All right. Now, if they are threatening abortion and they are bleeding, treatment is usually bed rest. Now, that is not to say that they may not need to have surgery. Now, let me see if it's on the next slide, which I doubt it probably will be, and it is not. Some miscarriages / abortions are incomplete, which means that all the fetal contents that are in the uterus are not expelled. If they are not removed, it can cause death. First, they will have a lot of pain and infection, and subsequent death if it's not addressed. So that is why this is a medical emergency in the event they start bleeding, because we don't know where they are in the process, okay? One thing is because you can lose too much blood. So we will start giving fluids. We don't want to give too many fluids, but just enough to keep the blood pressure at least 100, okay? For the advanced EMTs. Now the EMTs, there is nothing we can do except call for ALS intercept so they can come in, start an IV, and get some fluids going. That's if you have a transport time, may take a little bit. Traffic up here, that can happen at any time. So you may have to call for an intercept and get one of the supervisors to come out in one of the SUVs. They should have a jump bag and a drug box where they can come over, help you out, drop a line, start fluids, and you continue transport. Okay? So make sure you call for ALS intercept. But either way, we would absolutely, across the board, put them on oxygen. 15 liters non-rebreather. Yes, their O2 sat may already be 100%, 99, whatever. That's fine. Still put them on high flow oxygen. Because remember, we got aliens on board. Okay? Try to keep them as calm as possible. They may be freaking out because they're hurting bad. As EMTs, it's no pain medication you can give them. You would have to call for ALS intercept, get a paramedic at that point to give pain medications. Because even your aides can't give pain meds. Okay? So know what you can and can't do. Get help. Oh, it did get into it. It just took 4 slides. We've already gone over this about the incomplete abortions. Depending on how much contents are left is how painful it's going to be. All right. Now, in the event, let's say they take a plan B, that can cause a lot of pain too. Because what that helps do is interrupt some of the blood supply in the implantation process, so the body does not become pregnant. If taken within 72 hours of unprotected sex, you cannot wait a week and a half and take a plan B. At that point, 1, you've wasted money. 2, you may cause yourself some unnecessary pain because it may not work. At that point, you'll have to make a decision once you find out what you're going to do. Okay. Good to go so far? Oh, David, I sent you the email, so I didn't know if you want to pull it up on your phone or you're just good to go. Now, ectopic pregnancies. This is always fun because it's painful as hell. This is when implantation of the uterus, the embryo starts in the fallopian tubes or somewhere else in the abdominal cavity. It's somewhere it does not need to be. It is not in the uterus where it's supposed to be. There has been one instance that I know of, and I don't know if it's viable. I got to see if we can find this. Y'all know I like to find more videos of stuff. of a lady that found out she had an ectopic pregnancy and the fetus was adhered to her liver.
Was it what?
The fetus was adhered to her liver. Yeah. That blew my mind. I was like, okay, that's not good.
How far along was the fetus?
That is what I don't remember.
Yeah, I know you have to like take them, like get it surgically removed,
Mm-hmm.
because it's, okay, I mean, it's just gonna
It can kill
grow
you.
in your body, not place where you're shooting from.
Well, it's actually, if it's in the fallopian tubes, it'll stop growing and it'll rupture the tubes and the pregnancy will not be viable.
Oh, yeah.
But at that point, you're probably going to bleed a lot internally.
Yeah.
The fallopian tube would be different than being like in the abdominal cavity.
It's not meant to be like stretched.
No, it's not.
It doesn't. Yeah.
Can they, how long can they, grow inside the abdominal cavity?
That is a good question. I cannot answer.
Someone once told me about something called a stone baby.
Well, that is true. We'll get into that too.
Baby?
Yeah, it's
Yeah.
a lady in India was miscarrying. She did not have the surgery she needed to get rid of it, and it calcified in her body. That does not happen often. And eventually, she was having issues, and she had to have it surgically removed. And this was back a long time ago. She's in her 70s now, I want to say.
You sure it wasn't a kidney stone?
Yeah, it wasn't. When they cut it, they saw the formation of the baby.
Oh my goodness.
It was like, solid like a rock. It was like.
Yeah, we'll get to that video. But this is a video I found of an
This
ectopic
superfood
pregnancy.
does everything. I have it every day.
I am blown away. I love it.
Amazing.
I just love
Sarah's letter.
Now the cells can multiply a couple times in the tubes without us knowing. But once it hits a certain point, it's going to be too big for that tube and it's going to cause a lot of pain. Usually this is a medical emergency. They will not
What's up, guys? Welcome back to my channel.
be
So,
able
as you guys
to
could tell,
walk. No. Also, these women walking sometimes during pregnancy will help relieve some of the pelvic pain. With an ectopic pregnancy, it will not. And it may feel like a sharp shooting pain in the right or left lower abdomen. Sometimes it may be diffuse. It just depends on that person and how they register their pain.
What is diffuse again?
Means everywhere.
Everywhere in that region?
Mm-hmm. And the one she was talking about, it just,
Home baby,
that's one of them.
the 46-year pregnancy.
Yeah,
Yeah, I saw that video.
Is it 46 years?
yeah, this was a lady in India is the one I'm talking about.
She wasn't able to get like the baby out. So
No, she refused. There's a difference. She refused to have the surgery because she heard so many people dying and having complications of their C-sections and what have you. So she refused to have it done. Now the calcification I saw was not this one. Um,
That's not the one.
mm-mm.
It should be a type of stone baby.
That's what I want. Calcified stone baby calcified.
Oh, that's the one I saw. The 60 years. I think that's the one I saw.
Oh, this is the one in Chile. It's a couple of people that this has happened to.
Let's talk about the importance of taking care of your mental health. The key to great therapy is finding a therapist you can truly connect with.
She may have difficulty hearing, her gait slowed by arthritis, but otherwise, 91-year-old Estela Melendez is doing just fine. She lives in the peaceful town of La Boca, where the Rapel River meets the Pacific Ocean. But her quiet life was recently upended when she suffered a fall. A doctor spotted something concerning on her x-ray. The doctor said I had a tumor and that they needed to operate on me, Melendez says. But when a second x-ray was ordered to confirm, doctors couldn't believe their eyes. The mass they were looking at turned out not to be a tumor, but a fetus. Yes, that's right, a fetus. I have the lump here, Melendez says, touching her belly. For Melendez and her family, it's been quite a shock. Melendez became a widow in January when Manuel Gonzalez, her one and only husband for 74 years, died. The couple never had children. Upon further inspection, doctors now say the fetus has been in the elderly woman's uterus for more than 6 decades. Can you imagine? More than 60 years, the woman's nephew says. I wonder how she never felt bad once the fetus died inside of her. Doctors here at the local clinic considered surgery at first to remove the fetus, but later determined that, in this case, operating on a 91-year-old patient was riskier than doing nothing at all. Doctors say the fetus is calcified and poses no risk. Melendez says it hurts sometimes, but more often than not, it's just an uncomfortable lump. On a deeper level, she says, the lump in her belly reminds her of her recently departed husband and their unfulfilled dream of having a child all those years ago. Rafael Romo, CNN, La Boca, Chile.
Some get it unless you never had it removed.
Nope.
She still has it.
She still got it.
Now to our special report. Around the world, many
Okay.
Maybe it was like connected to like blood vessels or something. It was like complicated.
Well, no, when you look at her age, it could potentially cause more issues to put her under general anesthesia than it would be since something that's been sitting there for 60 years, leave it alone. Yeah. That's the reason they don't like to operate on really old people, because it takes longer for the anesthesia to come out of their system, and it can present other issues as far as resuscitation and how much to actually give them, where it will be therapeutic to do the surgery and not cause respiratory issues and kidney issues and heart issues from the anesthesia.
Recovery too.
Yeah. My grandmother was 90. What? How old was she? She was 98 when she broke the first femur.
98.
Yeah. And last year she was right at 100, I think, when she broke the other one.
How old is she now?
102.
Yes.
Beautiful. But given that they didn't have to the surgery was not as invasive, they went ahead and did it and put the little piece in there to stabilize her femur. But they were very worried about anesthesia. But since she was ambulatory and had no other medical issues really other than high blood pressure and fluid retention, they went ahead and did it. Because otherwise she had no other issues. But that's the issue that they have with some of these older women when this happens. Fetus. The one I saw was in India.
I think it was that first lady, because I think the one I saw was in India too. She doesn't look.
Yeah, this lady looks Asian.
Herschel Walker's accused of choking his wife until she passed out. He held a razor to her throat and repeatedly threatened to shoot her in the head.
He held a gun to my temple and said he was going to blow my brains out.
Hello, I'm Simon Whistler. You're watching the Today I Found Out YouTube channel, and in the video today, we're looking at the incredible story of a woman who gave birth to a stone baby.
Oh, this is one
Let's
I think
get
I saw.
started. Stone baby.
Not in
When
traditional
Huang
sense.
Yijun was 31 in 1948, she became pregnant. While there's nothing particularly remarkable about a random human woman becoming pregnant, Yijun's case was quite unique from start to finish, as you'll soon hear. For starters, shortly after Yijun became pregnant, she found out that she had an ectopic pregnancy, meaning the egg had not attached in the uterus. In most ectopic pregnancies, the egg will implant in the fallopian tubes, but in Huang's case, the egg implanted just outside her fallopian tubes, causing what is known as an abdominal pregnancy. These are very rare, with only about 1% of all ectopic pregnancies falling into this category, about 0.0001% of all pregnancies. In abdominal pregnancies, the embryo often attaches to organs inside the abdomen and can even attach to such things as a woman's liver, diaphragm, bowels, or spleen. Surprisingly, an abdominal pregnancy is not necessarily a death sentence for the growing baby, though there are significant risks to the mother and baby, and the few such babies who do end up surviving have a 21% chance of having birth defects, in part due to lack of amniotic fluid buffer and more compression than the baby would otherwise experience in the uterus. In Huang's case, the baby did not survive. If the baby dies when it is small enough, the tissues will typically break down and the body will get rid of it naturally. In Huang's case, though, the baby was large enough that her body was unable to do this. The doctors told her this would be the case, and they recommended she get it removed to avoid any potential health problems from it down the line. Unfortunately, the charge for the surgery, converted to US dollars, would have been about $150, or approximately $1,500 today. As Huang said, it was a huge sum at the time, more than the whole family earned in several years, so I did nothing and ignored it. In cases where the baby is too large for the body to get rid of it, instead calcium deposits will build up around the dead tissue, turning the fetus into a so-called stone baby, or more technically, a lithopedion. Women who have this happen are often unaware of it. In known cases of stone babies, the average time span of carrying the fetus is about 22 years. Because of this, the woman can even have other children despite the presence of the stone baby. Of course, in Huang's case, she was well aware of the presence of the stone baby, simply unable to afford to get rid of it. Fast forward to 2009, when Huang was 92 years old, and at that point, after having carried the rather large fetus inside her body for 60 years, she finally was able to have it removed. Bonus facts. While lithopedion was first described in the 10th century by Albucasis, the first famous case of a stone baby was from a 68-year-old woman named Columbe Chartry from France in 1582. For about 28 years of Chatri's life, she had complained of abdominal pain, and there was definitely some large, very hard mass in her abdomen. When Chatry died, an autopsy was performed, at which point the physician discovered the stone baby. This particular calcified fetus was then sold, as well as drawings of it, which sold like hotcakes. The fetus was passed around over the years before finally ending up in the Danish Museum of Natural History and was subsequently lost. Bonus fact 2. The earliest known case of a lithopedion was discovered by archaeologists who found a stone baby whose mother had lived around 1100 BC. While the actual number is probably much larger due to the women often not knowing of their calcified fetuses, to date only about 300 cases of lithopedion have been documented. So I really hope you liked that video, and if you did like it, click like below and leave us a comment to let us know what you think. And also check out a couple of our other videos, which are linked to on the screen now, and don't forget to subscribe for brand new videos every day. Thanks for watching.
All right. That was exciting. So we're going to stop for a minute and so you can have a break. And we'll come back in about what, 5 minutes?